Welcome to your 30-minute foot health sequence. For today, you'll just need one of your therapy balls out of the tote and your yoga mat. We'll start off by doing a little bit of ankle range of motion, then we'll get right into rolling out the feet, and then we'll work on a few toe exercises at the very end to finish off our sequence. So you'll start by shifting your weight into, let's say, the right foot. I'll mirror you. You can have the hands on the hips for support. If you find you don't have the best balance, it might be best to be near a wall so that you can reach out for the wall if you need it. We'll lift the left foot up off the ground and bring the foot just slightly out in front of you, enough space so that you can point the toes toward the ground and flex the toes toward the shin bone. Doing that a few times, pointing and flexing. And then we'll circle out the ankle a few times as well. In both directions, notice if there's any creaks and cracks. Notice your range of motion with your ankle, how far you can come into each movement. And we'll add in inversion and eversion as well. So this is a movement that we typically forget about that the ankle is capable of. An inversion looks like this. It's bringing the sole of the foot inward, and eversion bringing the sole of the foot outward. So I like to think of it as a little queen wave, bringing the sole of the foot inward and outward. This is a very important movement of the ankle that, again, we typically forget about, but it's important to include in your ankle range of motion series to get the ankle moving and mobile and keep it healthy. Good, we'll set that foot down and switch sides, shifting the weight into the left foot this time so you can pick the right foot up, pointing the toes towards the ground and flexing the toes toward the shin bone. Notice if you have more or less range with this foot and ankle. And a few circles here as well. In opposite direction. And again, coming into that inversion and eversion, the little queen wave with the ankle. A little bit of an awkward movement if you've never completely isolated it and done this one before. Sole of the foot turns inward, and then the sole of the foot turns outward. Good, and we'll set that foot back down and just march in place to reset the pelvis here. Next, we'll use the one tune-up ball, and we'll start off with the left foot. I'll shimmy myself off to the side a little bit so that you can see a bit better, but basically you'd like your right foot slightly behind you, almost in a modified or shortened warrior one stance, and we'll be placing the tune-up ball underneath the left foot to start, just in the space below the big toe. I can show it. Just in the space below the big toe here is where you want to start. You should be able to see a little bit of the therapy ball poking out to the side. Maybe 25% of the therapy ball is showing from the side of the foot. Hands can be on the hips here. As you bend into that front knee, shift the weight forward and apply weight forward into that space. We'll press and release here, taking the weight on and off. So you can go ahead and straighten out that front knee, lean the weight back a little bit, take the weight off, and bend into that front knee, shift the weight forward, and apply pressure here again. Pressing and releasing into this space. It's a common bunion area, so it's very normal for this area to be a bit tender. And we'll start to work slowly towards the pinky toe. So working in that space just underneath all of the toes. Pressing and releasing as you move across. Shifting your weight forward and back to press and release, and using that bend in the front knee as well. And eventually, as you get to the pinky toe space here, again, you should see a little bit of the therapy ball poking out from the side of the foot. And spending a bit of extra time here as well, just like we did with the big toe space, as this is another common bunion spot or common high friction area that needs a bit of extra attention, as sometimes we can get some calcifications here. And you can go ahead and press and release all the way back towards the big toe. Good. The next spot we'll be working with is just at the top of the arch of the foot. So right here, the top of the arch is where you'll want the therapy ball to be. There should be a little depression here almost, and that's right where the therapy ball will sink in. Still in this shortened warrior one stance, still feel free to grab a hold of a wall or something beside you if your balance is lacking a little bit today. Hands can be on the hips, and you should have the edge of the heel on the mat here. Start to press and release, leaning the weight forward and back and bending and straightening that front knee. See if you can spread and wiggle the toes, especially as you apply the weight forward. Might be a bit challenging. We don't tend to have full control over the movements of the toes and the feet, just because we wear shoes a lot and we tend to not have full motor control of this area, unfortunately, which is why it's really important to roll this area out to prevent or treat plantar fasciitis, to help with just foot pain and foot mobility and ankle mobility as well. And the next time you press into the same spot in the top of the arch of the foot, we'll hold here. Keep a strong bend in that front knee, so you're applying the weight forward and holding. And then we'll add in that little eversion and inversion that we did earlier on. So bringing the sole of the foot to point outward for eversion, sole of the foot to point inward for inversion. What we're doing is cross-fibering the plantar fascia here. So the plantar fascia runs up and down from the toes toward the heel, and we're massaging in the opposite direction of the fibers. This will help to break up any adhesions or perhaps even scar tissue in this area. Good, and I'll offer one more option here. This is more of an advanced variation. So if you have tender feet, or if you do happen to have plantar fasciitis, you might want to skip out on this one. What you'll do is shorten your stance even more, lift the edge of the heel up off the ground, press the weight down into that same point we're working with, and start to rotate the whole hip, lower leg, and foot from side to side here. And it's almost as if you're juicing an orange or juicing your therapy ball. As gross as that sounds. And again, this is a really great mobility activity for the fascia of the foot. Good, you can step off of this now and just give the foot a little bit of a break. Maybe shake it out, circle out the ankle. If you need to almost maneuver your therapy ball back into a circle, if it got a little squished, you can feel free to do that before we move on to the next point. And the next spot we'll work with is at the bottom of the arch of the foot. Instead of the top of the arch, we're skipping the whole arch altogether, and our next point is just above the heel there. Coming back into that modified warrior one stance. And depending on how big your foot is, you should still be able to have the very edge of the heel on the ground, hopefully for this one. Hands on the hips, bend into the front knee, apply the weight forward, and release. And all of these points are, we're getting into the points of the feet that might be a little bit tender. So if it is tender, if it does feel a little stuck in the tissue of the foot here, don't worry about that. That's completely normal. Our feet carry us around all day long when we're standing, when we're walking, and we tend to forget about taking care of the feet. So it's normal for these points to feel tender. And same thing here, next time you press into this point, keep a strong bend in the front knee, keep your weight leaning forward, and we'll try that inversion and eversion of the ankle again. Turning the sole of the foot inward, sole of the foot outward. Or basically you can think of it as bringing the inner edge of the foot down towards the mat and then the outer edge of the foot down towards the mat. While applying pressure, cross-fibering that plantar fascia. Good, and back to center here. And that last option, or the more advanced variation, would be lifting the heel up off the ground here, applying pressure downward and juicing your therapy ball as if you're juicing an orange or a lemon. Rotating the hip, lower leg and foot, inward and outward. Pinning and spinning the tissue of the bottom of the foot. Awesome, you can step off of that, maybe shake out the foot, circle out the ankle. And again, if you need to just kind of shape your therapy ball back into a circle, feel free to do that right now. We'll work with a few more points. So the outside edge of the foot tends to get pretty tender as well, especially in one particular area that we'll focus on. If you look at the outside edge of your foot, so the pinky toe side of your foot, you'll see a little bump just about halfway down the side of the foot. And that little bump, it's very subtle. It has a big fancy anatomical name called the tuberosity of the fifth metatarsal. But basically it's where all of these side lower leg muscles insert into. And the reason why it's so important to press into this area of insertion of those muscles are responsible for everting the ankle. So doing this motion here. And what a lot of us tend to do is when we have weak knees and weak quad muscles, we tend to pronate the feet. And we tend to knock the knees in, which means that the ankle and foot are in this constant eversion. So these muscles are typically pretty tight. If we press and massage into their insertion point, it helps to relieve tension throughout the entire muscle belly. So we'll go ahead and give that a try. So on that same left foot, you'll find that little bump along halfway down the side of the foot. You should be able to see about half of the therapy ball poking out from the side of the foot. Bend into that front knee, press into that area, and release. Try pressing and releasing to that spot a few more times. It might feel a bit tender, and that's okay. And then we'll just start to press and release along the entire outside edge or pinky toe side edge of the foot. Pressing and releasing from the pinky toe all the way down to the heel and back up again. And the entire time you should see maybe quarter to half of the therapy ball poking out from the side of the foot. Good. Then last exercise we'll do before we do everything on the other side is a toe extension stretch. So the toes can do extension, which is lifting the toes back towards the shin bone, and they can also do flexion, so curling the toes under. So we'll do an extension stretch first for the big toe and then for the rest of the toes, and maybe we'll even try a little bit of a flexion activity as well, which can be a little bit challenging. So we'll start with the big toe. Try and place just the big toe, maybe the second toe gets tossed in there as well, that's okay. Onto the therapy ball and have the pad of the big toe or big foot or the space just underneath the big toe pressing into the mat if you can. So you're almost giving yourself a thumbs up, but with the big toe. You might feel a little stretch on the underside of the foot. Holding that just as you would with any stretch for 10, 15, 20 seconds here and following the breath through the belly. And then we'll try the rest of the toes here as well. So forgetting about the big toe for a second and seeing if you can get the middle three toes, maybe even the pinky toe gets tossed in there. Pressing the belly of the toes onto the therapy ball. And seeing if you can press the rest of the foot down into the floor so that you're getting a nice stretch on the underside of the foot. Awesome. We'll shake that out and we'll try one flexion activity for the toes here. This one is quite difficult. What you'll do is see if you can wrap the toes around the therapy ball and try and pick the therapy ball up. It's a little bit hard. Even the action of just trying to do this is helping the strength of your toes. You might get it off the ground for a second or not at all, and that's totally okay. And sometimes this is easier to do with a yoga strap, so if you'd like to try this afterwards with a yoga strap, just practicing flexion of the toes and strength of the plantar fascia, you can go ahead and give that a try later. So before we switch sides, we'll plant both feet down onto the floor, roll the shoulders back, palms face forward, close the eyes. And notice how the left foot feels in comparison to the right foot. The left foot might feel more grounded. You might just be more aware of the foot in general. You might be able to feel the increased blood flow to the area. That left foot might feel flatter to the ground compared to the other side. Then when you're ready, you can open the eyes and we'll go ahead and switch sides. So we'll switch over to that left foot and we'll start just as we did before in the area just underneath the big toe. And you'll go ahead and find that modified or shortened warrior one stance with the back foot on a 45-degree angle, more or less. You should be able to see a little bit of the therapy ball poking out from the side of the foot. Hands on the hips. Go ahead and press the weight forward, bending strong into that front knee. And send the weight back, straightening out the front knee and taking the pressure off. And continue just like this, pressing the weight forward and back. And start to work across the area just underneath all the toes as we did on the other side, pressing and releasing into the area underneath the second, third, fourth toes. Pressing and releasing. And once you get to the pinky toe, you should see a little bit of the therapy ball poking out from the side again, pressing into this area and spending a bit more time here as well, as this, just like the big toe, is a high contact area, a point of friction, especially when we're wearing shoes. Sometimes this area is where you get blisters. So spending a bit of extra time pressing and releasing into this area. And go ahead and work your way back towards the big toe, taking your time to get there. The next point we'll work with is that top of the arch of the foot. Should be a little depression there, right where the therapy ball should sink into. The edge of the heel can be on the ground here, still having a good amount of space between the feet. Press and release into this point and see if you can move the toes as you do this. Notice if this foot seems to be more or less tender than the other foot, or it's perhaps about the same. Oftentimes we tend to, when we're standing, lean our weight into one foot or one hip in comparison to the other, and that's the foot that will typically be more tender. The next time you press forward, bending into that front knee, apply the weight and hold into this point. And we'll start to invert and evert the ankle, just as we did before, bringing the big toe side of the foot down towards the mat, and then the pinky toe side of the foot down. Good, and back to center with the foot. Perhaps you're trying the more advanced variation here, and that is lifting the heel up off of the ground, applying weight still, keeping a bend in the front knee if you can, and starting to rotate the hip and foot from side to side, pinning and spinning the therapy ball. Notice how this feels on the bottom of the foot. Maybe it's a very new sensation. Maybe you've never done this before, and that's okay. Taking in how it feels. Good, you can take your weight off of that and just squish the therapy ball back into a circle. And then we'll work into our next point here, which is at the bottom of the arch of the foot. So just above the heel, you don't want to be on the heel at all, at least not for this one. We'll be right above it. The edge of the heel can still be touching the ground here if possible, and we'll bend and release a few more times here, pressing the weight forward, bending into that front knee, and then releasing the weight back. Seeing if you can wiggle and spread the toes, especially as you apply weight forward. And then we'll press down into this point, keep a strong bend in that front knee, edge of the heel is still touching the ground, and we'll bring the foot into eversion and inversion while applying weight here. That little queen wave with the ankle, sole of the foot turns inward and outward. Good, and the last more advanced variation here is same as we did before. Lifting the heel up off of the ground, still applying pressure downward, inducing your therapy ball here, spinning it, spinning the foot from side to side. Spinning and mobilizing the fascia and the tissues of the bottom of the foot. Good, we'll take the foot off of the therapy ball and again, just maybe press it a little back into shape. And the next point we'll do is what we talked about where those lower leg or side lower leg muscles insert into that little bump on the outside edge of the foot. See if you can find, it's very subtle. And once you've found it, placing the therapy ball there on the outer edge of the foot, you should be able to see a little bit of the therapy ball poking out from the side. Press and release a few times into this point. And then we'll press and release along the entire outside edge or pinky toe side of the foot. Pressing from the pinky toe all the way to the heel. And our last activity here is the extension and flexion of the toes. Starting with the extension stretch, placing just the big toe if you can, maybe the second toe gets thrown in there as well, onto the therapy ball. And see if you can have the ball of the foot pressing down into the ground here so that you're only getting the extension stretch for the big toe. You might feel that stretch along the underside of the big toe and the underside of the foot. And then bringing the stretch in for the rest of the toes as well. Tossing the big toe off to the side if you can. And bringing the second, third, and fourth toes up onto the therapy ball. Seeing if you can press the ball of the foot down into the ground so that you're able to get a nice stretch on the underside of these toes. Holding that stretch and breathing through the belly. And then coming out of the stretch and shaking out the foot a little bit, circling out the ankle perhaps. We'll give our little challenge one last try on this side before we come into a little exercise for the toes and end our session. So the challenge was the flexion activity on the other side, seeing if you can wrap the toes around the therapy ball and try and pick it up. And again, it's okay if you can't pick the therapy ball up. Just the action of trying this is enough to get those muscles working. Good. And we'll place both feet back down onto the ground, roll the shoulders back, close the eyes, and notice how the feet feel. You can gently open the eyes, and we'll do one last activity here before ending the session, which is just trying to lift the big toes up off of the ground. So working actively into big toe extensions. We did that passive big toe extension stretch, and now seeing if you can lift the big toes up off the ground. You can try both at the same time, basically giving yourself 2 thumbs up with the big toes and keeping the rest of the toes down. And again, just like the flexion activity, it's okay if you can't quite do this, but just giving it a try is a nice activity for the brain and for the feet. And setting those big toes down if they're lifted. You can shake out the hips here, maybe place the hands on the hips and circle them out. And then bringing the hands to a prayer position in front of the chest. Seeing how the feet feel, and after this session ends, you can go ahead and walk around and notice if there's any difference in how the feet feel as you're walking and moving. Go ahead and check out the rest of the videos on the healthyhips.ca website. We have a variety of classes, a variety of different lengths of classes to suit your needs, and different styles as well. We have things other than just the feet. We have the hips, we have the core, activities for the spine, so go ahead and give those a try. Have a wonderful day. Namaste.